The CDC is urging companies to have their employees work from home whenever possible, citing a new report that studied COVID exposure. They found employed adults who tested positive for COVID were almost twice as likely to report going regularly to work. That doesn't mean that all employees got the virus at work, but the CDC is using the study to minimize additional exposure, telling companies providing the option to work from home or telework when possible is an important consideration for reducing the risk for COVID-19 infection.
We see it be effective both from a reduced transmission in the workplace, and that's all predicated on number of contacts to increase productivity, decrease overhead costs.
For companies unable to provide telework, implementing safety measures can help minimize COVID exposure.
Preparation is going to be all about practice. Wearing masks, good hand hygiene, using alcohol cleansers when you can, if not washing your hands, and then the social distancing, and those need practice.
Dr. Anthony Harris from occupational health company WorkCare says employers should invest in screening, temperature checks, and better HVAC systems, even though it costs more.
The benefit there is that you're turning over the air at least 6 times an hour and putting in place HEPA filters if you don't have those in place now, and that helps clean the air as well.
The CDC study also may give us insights on how COVID is impacting different types of people. The majority of teleworkers in their study were high-earning, well-educated, non-Hispanic white people. Black and Latinx communities are disproportionately affected by COVID-19, and they are more likely to be essential workers with less telework options. For example, of the over 16,000 COVID cases in the meatpacking and poultry plants, the majority of those affected were minorities.
I was a part of testing in the meatpacking industry early on in the summer in Texas, and we saw a positive rate of over 65% of the workforce.
For those who can continue to work remotely, Dr. Harris says it's not just for COVID prevention.
Flu season will be less impactful from a health standpoint because of the limited interpersonal contact.
Kat Sandoval, Newsy, Chicago.